Dr. Sim, a lot of pre-medical students don't know the potential route outside of orthopedic surgery, and that is PM&R. Do you mind just commenting on that, what it is? You matched into it, so would love your 2 cents.
Yeah, absolutely. So it's PM&R is the specialty. That's kind of the abbreviation. So it stands for physical medicine and rehabilitation. So some people will think that people that wanted to go into ortho go into this. Also, people think we are psychiatry because another term for PM&R is like if you're a practicing physician in PM&R, you're a physiatrist, which sounds like psychiatrist. So if you Google a lot of PM&R doctors, like it'll say Google always puts them as psychiatrists, which is not the case. Some people think we're physical therapists, which we're also not. So let me kind of explain what PM&R is. So physical medicine or rehabilitation, it's sort of like interventional musculoskeletal medicine, as well as neuro, as well as acute rehabilitation, all in one. And so I'll kind of give you the different avenues and what I train in and the different areas that you can then go into. So in residency, you're going to get a breadth of experience. So a lot of your time is spent in an acute rehab. So someone who, for example, had a polytrauma and maybe you as the orthopedic surgeon operated on them, but they're not ready to go home, right? They're not back to their functional goals. They're not walking. They're not going up steps yet. We can't just expect them to go home at that point. So where do they go? Well, if there is a ability for them to hopefully quickly progress and meet the certain goals, they'll come to an acute rehab. And so I like to talk about acute rehab as the Goldilocks zone. If you're too bad, you can't go to acute rehab. And if you're too good, you can't go to acute rehab. And what I mean by good and bad is like just in terms of functional status. So if you're not going to make any progress, maybe it doesn't make sense. And if you're so good, you're already walking and jumping around, obviously you don't need it. And so I spent a lot of time on the inpatient floors doing that. So actually we do like a year of essentially medicine because even when I'm on that floor, I'm managing their diabetes, their high blood pressure. Like a lot of these patients have multifactorial issues, a lot of comorbidities. And so we're managing that from a physician perspective. But the main goal that they're there is so that they can get physical therapy, occupational therapy, and speech therapy if they need it. For example, we work with a lot of stroke patients who then have speech issues and swallow issues that they need to help overcome. So that's one aspect of it.